Greetings, everybody. So glad you're here. I'm going to be talking about healthcare as a human right as a principled approach. To work for the right to healthcare and the bigger right to health, because these are human rights, which we all deserve, means much more than the slogan, healthcare as a human right. With a human rights approach, we choose an alternative vision of a decent society to the neoliberal nightmare that's being offered. Demanding healthcare as a human right puts us at the forefront of a countrywide movement which analyzes what's wrong with our healthcare system according to international human rights law principles. Government is required to respect, protect, and fulfill the right to healthcare, including by regulating private actors. The legal principles which define the human right to health care are globally accepted, even if our country has been slow to recognize them. Because leaders like Dr. King and social movements have been sidelined when they tried to organize for full human rights doesn't mean that we should give up. Studying social movements makes us realize how long it takes for a movement to come to fruition. A human rights movement means working against commodification of healthcare, which is eating away at the single-payer finance systems we do have, like Medicare and the VA. Human rights principles can be articulated and measured. Adherence to the principles can be compared between states and between political subdivisions of states like cities. The members of PNHP, its allies, and the public at large, which join this movement, can use human rights principles in organizing information about violations of the right to health care. We can call on our national government to account for its human rights record before the UN Human Rights Council and other treaty monitoring bodies. We can use these principles to organize for our ultimate desire a legal system that fully recognizes healthcare as a human right in statute, in judicial decisions, and administrative practice. The movement for healthcare as a human right is complementary to movements for democracy, for even basic majoritarian democratic attempts to regulate campaign financing, but more profoundly for movements for participatory democracy. Using the principles to organize and analyze the gap between the human right to health care and the reality can open up the debate about how we have allowed replication of unjust hierarchies and what we need to do to change. A fully functioning participatory democracy is the only guarantee for human rights, all human rights, including the right to health care. The first challenge in a principled approach is that health care is incorporated and guaranteed in law as a human right, something still to be achieved, although the state of Vermont has made some important history for us with their movement for health care as a human right and their new state law. Specific legally recognized principles constitute the elements of the right to health care. All of these principles are required, they're interdependent. A government can't pick and choose which principles are easier or the ones it prefers. Four elements make up the compound principle of universal access: universal, affordable, comprehensive, and equitable. The other principles are availability of care, acceptable and dignified care, equality and non-discrimination, quality of care, transparency and information access, participation, and accountability. Universal access to all health goods, services, and facilities requires that all human beings who reside in our country, no exceptions, have care. That care is affordable from the standpoint of the individual needing it, without such barriers as co-insurance, co-pays and deductibles, and free at the point of access, and not requiring the sacrifice of other human rights to get it. Universal access also requires the same comprehensive care, the full suite of goods and services for each person, not a tiered system. Universal access operates according to equity to ensure that care is provided according to the need of the person Equity is important because it invokes the notion of citizenship rather than consuming, that we are all in the same society and responsible jointly for our public welfare. Equity embraces the idea that tailoring care to individual needs is humane and just. The principle of availability mandates that health infrastructure, goods, and services be within reach, regardless of where the person lives, be it city or tribal reservation. Availability looks at the numbers and distributions of doctors to deliver primary care. It does not allow the market to determine availability, and replaces that with regulatory law that serves all and ensures a system with incentives for primary health care in a system built on human rights principles. Another principle is that individuals should have acceptable and dignified care. Each person receiving care is deserving of respect, and the system can be designed to promote this. Care must be culturally appropriate. Another principle is non-discrimination and equality. All other principles of the human right to health care are conditioned on equality and non-discrimination. Non-discrimination refers to access as well as outcomes. The governmental duties run from respect to protection to fulfillment, moving from negative duties to increasingly more positive measures. A government respects non-discrimination in health care when it adopts and enforces laws which don't permit discrimination and mandate equal treatment, such as those prohibiting private actors from discriminating against women by denying reproductive health care like contraceptives. Grossly disparate maternal mortality rates for African American and Native American women requires government to step up to its duty to fulfill the right to equal health care and necessitates various special measures. Human rights principles broadly define who is entitled to protection from discrimination. People who are imprisoned and detained, all immigrants who reside in the U.S. regardless of documentation status, persons with disabilities. Discrimination is prohibited based on race, ethnicity, color, sex, sexual orientation, gender, language, religion, political or other opinion, property, meaning wealth, birth, national or social origin, health status. To guarantee the principle of quality, the human rights norm requires each country to offer the highest attainable standard for physical and mental health. It requires a minimum core of essential services. It does require nations to provide higher quality health care if they have greater resources. So the quality of care in the United States for each person should be higher than, for example, South Korea, the UK, Cuba, given relative GDPs. Finally, the principles of transparency, information access, and participation involve civil rights relating to freedom of expression, association, and assembly. Individuals need these rights, these principles, to realize the substantive right to health care. And of course, no human right would mean much if it didn't include the principle of accountability. Accountability means each person has a meaningful, appropriate, and prompt remedy when the healthcare system fails. It also requires fully functioning systemic mechanisms of accountability to the public. Thank you.